One of the most vulnerable moments in healthcare is when a patient leaves the hospital and goes back home. And this is where a lot of things start to fall apart. Patients are discharged with medication changes, follow up appointments, specialist referrals, discharge instructions, and sometimes a completely different level of functioning than they had before hospitalization. And without proper follow up and support, many patients end up right back in the emergency room. That is exactly why transitional care management, also known as TCM, exists. And nurses play a major role in making these transitions safer and more effective for patients. If you're new here, my name is Natasha. I'm a registered nurse and care management consultant, and I help nurses and healthcare organizations better understand the role of nurses in care management and value-based care. One thing nurses need to understand is a successful transition from hospital to home is not just about discharge, it's about continuity of care. So let's break this down simply. Transitional Care Management, or TCM, is a Medicare service designed to support patients transitioning from a hospital, skilled nursing facility, rehab facility, or other inpatient setting back into the community. The goal is to reduce complications, improve follow-up care, and help prevent avoidable readmissions. Because the reality is, many patients leave the hospital still very vulnerable. They may be weak, confused about medications, unsure about follow-up appointments, overwhelmed by discharge instructions, or struggling to manage new diagnoses and treatment plans. TCM includes things like post-discharge follow-up, medication reconciliation, coordination with providers and specialists, reviewing discharge instructions, helping patients access community resources, patient education, scheduling follow-up visits, and while the provider bills the transitional care management service, nurses are often heavily involved in supporting the transition itself. Now, to really understand TCM, you have to understand the healthcare problem it was created to address. Hospital readmissions are expensive, but more importantly, poor transitions can seriously impact patient outcomes. Many patients leave the hospital and fall through the cracks. Maybe they cannot get their medications, they don't understand the discharge plan, maybe no one followed up with them after discharge, or they missed their follow-up appointment. They may have started declining again at home and nobody recognized the warning signs early enough. As nurses, we see this happen all the time. Patients are discharged medically stable but not always fully supported. That gap between hospital discharge and successful recovery at home is where transitional care management becomes incredibly important. Primary care practices are already overwhelmed. Providers are managing high patient volumes, documentation, staffing shortages, prior authorizations, administrative responsibilities, quality metrics, and patient follow-up. So, consistently managing post-discharge communication and coordination can become very difficult without strong systems in place. Patients need timely follow-up, medication lists need reviewing, appointments need scheduling, discharge instructions need reinforcement. Families often need support and education too, and all of this requires coordination, communication, and workflow. That is exactly when nurses bring tremendous value. Nurses are uniquely positioned to support transitional care because we already understand how quickly patients can decline after discharge when there is poor follow-up. We educate patients, identify red flags, coordinate care, communicate with families, review medications, advocate for patients, and we help bridge gaps between healthcare settings. Nurses often recognize problems long before they become emergencies. That is why nursing is so important in transitional care, because successful transitions are not just clinical, they are operational, educational, emotional, and relational. Patients need support during vulnerable moments, And this creates opportunities for nurses interested in care management, care coordination, consulting, and value based care models. TCM is part of a much larger shift happening in healthcare. Healthcare is moving towards prevention, reducing avoidable readmissions, improving patient outcomes, care coordination, population health, value based care, and transitions of care are a major quality focus in healthcare. Because healthcare organizations are realizing that what happens after discharge matters just as much as what happens during hospitalization, and nurses are essential to improving those outcomes. Because technology alone cannot replace patient support, communication, education, and human connection. That human element still matters. If you're a nurse and you're interested in learning more about care management, value based care, and how nurses can build businesses and consulting opportunities around these healthcare models, I go into this inside my mentorship. I'll show you how these services work operationally, how nurses fit into them, and how to position yourself in this growing area of healthcare. You can check that out in the description below. And if this video was helpful, make sure you subscribe because I'll be breaking down more care management and value-based care topics for nurses.